Two is different concepts. Initially, I'll tell you as a theoretical part, keep it in your mind. One is the insertion, whether insertion should be rapid or slow or intermediate. Rapid insertion, rapid withdrawal, there are the two different concepts. The different authors tells the different things, but according to my clinical experience, when the tonification, sedation, two different things. Tonification, sedation is the two different topics. What exactly is the tonification? What is sedation? In our body, yes, please come on.
Tonification is to increase and stimulation is to decrease.
Good.
Energy.
Very good. So it increasing the energy or decreasing the energy. The disease wise we understand. There are the deficiency energy also causes the problem. There is the excessive energy also causing the problem. Then how we do understand this? The chi get excessiveness according to our organ clock theory, 5 elements theory, nature of the disease. One organ is supporting to other organ. Each and every organ having the mother and son sequences. Mother is holding the energy, not passing to the child. Child having the deficiency. Child required the energy. Mother doesn't want the energy. Mother need to pass on the energy. Mother need to drain the energy. In this particular situation, one sedate the energy to the mother and give the energy to the son. Right? And when we wanted to treat for the son, then reinforcing method is required, stabilizing the energy is required, tonification is required, giving the energy to that particular organ is required. But you are giving, but somewhere you are sedating as well. Somewhere you are taking the energy and reinforcing to deficiency organ. Where you are taking the energy, that means that you are depleting the energy of the mother and then you are reinforcing the energy to the son. When you require the energy to the son, then the tonification to be taken place. Insertion rapidly. Insertion rapidly with inhalation. This some controversy is there with the different authors. This is my perception, right? Insert the needle with inhalation. Inhalation, that oxygen is required. Energy is required to the body. Then rapid insertion is there. Do it and then slowly withdraw the needle and then close the hole. Whatever we given the energy, that shouldn't come out. Then we wanted to extract the energy, drain out the energy. That particular time, insert it slowly, withdraw rapidly, open the hole. That means whatever the excess energy is there, that should come out and make the hole bigger and larger and then extract the energy, which is unwanted energy, evil energy, toxic energy, turbid energy, right? So likewise, so insertion and retention withdrawal needle is the very really important, but this also we should learn. But great Pu law, great Pu and Shi law, there is a law is there, but that you will going to learn. So retention of the needle, how many minutes is required really is the ideal time. But here I wanted to tell you, there are the numerous theories are there. I believe in all the theories. According to the situation, according to the clinical setup, according to the professional patients I am seeing, there it get differentiate. That means when I am at home, I wanted to treat, then that particular time I am analyzing the patient, sitting in my own place, and then inserted the needle. After 5 minutes you just withdraw the needle, that's quite enough, irrespective of the tonification or sedation. For the children I wanted to treat, right? That time not required half an hour. For mother I wanted to treat, or my wife I wanted to treat, or I wanted to take up the treatment myself, then I just apply. When sleeping, that time I just take only 30 minutes nap I take. So I just apply anywhere needle, for example, anywhere, wherever it is required. Then I kept, sleep and take the nap for 30 minutes. Once I wake up, that time I just take off the needles. When I am sitting in that particular situation, not thus taking the nap time, so that time I just insert the needle, not even 5 minutes I withdraw the needle for myself. Even for the children also same. When I wanted to do professionally at home, with the patients, then in our center, then it is required, I'll mention 20 minutes you just lie down, I do the procedure. After finishing 20 minutes, I'll do the other procedure like doing the cupping, dry cupping or something, and then for the patient having the placebo effect, and then you take off all those things. 30 minutes the treatment procedure will going to complete. If you wanted to retention only the needles, 30 minutes you just keep it, that also quite enough. But scientifically I told, how many minutes I told?
5 minutes.
20 minutes.
No.
20
Very good. 28 minutes and 29 seconds has been. The Chinese people told me, so scientifically this must to be keep it. Right? So only that much you can keep it, that's quite enough. That means ultimately 30 minutes needling. Right. If the scalp acupuncture you are doing, the hemiplegia, paraplegia condition, not less than 45 minutes, let it be there. 1 hour, 2 hours the needle should be there. There is no harm. Let it be there. If they are under our circumstances, our surveillances, in our hospital, in our OPD, under our control, they are going outside is not recommended. Even sometimes I feel I just apply the needle, send them to patient to the home, let they withdraw the needle after 2 hours, 3 hours later. But it's not so safe. If something goes wrong, then this itself is causing the problem. The question arises, but we shouldn't give that chance to the patient. Right. Then the angle of the direction, this called as a word is the opticography. Opticography, not the topography. But this is in fact the direction of the insertion at the specific directions is the very imperative. Whether you wanted to insert the needle is the perpendicular or the oblique insertion or the horizontal insertion or the transverse cutaneous stimulation. Right? This is the perpendicular oblique, the oblique transverse or the horizontal transverse direction. There are the numerous directions. But however you understand, when I wanted to use on the shoulder muscles, then use the perpendicular where the enough shoulder muscles are there. When I wanted to use on the anterior tibialis muscles where the stomach 36 is there, apply the perpendicular needle insertion, we have the enough muscles. When we wanted to use the piriformis muscle on our back or the lumbaricum, quadratus lumbaris muscles, you just insert the deeper muscles. No insertion. When you wanted to use the multifidus muscles, you deeper muscles. You wanted the rhomboid muscles, you deeper muscles. Yes, I am coming now. Right. So in this way perpendicular you understand. Where this muscles is there, apply the perpendicular insertion. When we wanted to use the oblique muscle, oblique direction, that means slightly slanting the direction. Slanting the direction around, that is perpendicular is 90 degree. Right? Then I wanted to use as a 80 degree, is slightly bent. Wanted to use as 70 degree, further slightly deviate the needle. Likewise, now I just apply the point is Sulio. Sulio is large intestine 12. So I just applied perpendicular insertion. Perpendicular insertion. I wanted to use a slightly change. I changed it in the different direction. This in fact is the oblique direction, 45 degree. Where is the perpendicular? Where is the slanting? 45 degree. When I wanted to use furthermore, this called as a 15 degree. Slanting, yes, tonification. This I am talking about the directions. Then I wanted to use no as a horizontal direction. So this is again, it is touching to my skin. This is the 5 degree. Right? This is the cutaneous needling or the subcutaneous needling. Right? You can use this, yes. 90 degree without taking out the needle, now it is 0 degree. Right? So in this way we... Sorry?
Can you please show us?
I need to show you once again, you mean to say?
Yes, sir.
Yes. Just I take the needle now, right? If I use the same needle, I'll get a slightly pain. If I use the new needle, I don't feel much pain. What do you suggest?
Take the new needles.
Okay. Even I am into that. Now, I just apply perpendicular needle now, again on the large intestine 12 point. I just inserted perpendicular direction. Right? Perpendicular direction. Now, this is perpendicular 90 degree. Now, I wanted to slightly deviate that. I just applied. Now is 45 degree. Right? Now, I wanted to change this needle towards the upward direction as a 0 degree. Now you can see the same needle is 0 degree. Now whatever I want I can play, right? Throw ball, basketball, volleyball, football, anything I wanted to play I can play. Athletics also can be done with acupuncture needles as well. When the LU7 also is the horizontal direction, insert the LU7 and play the basketball, running ball, whatever you wanted to do, you just do it. I don't feel any pain, right? Really, I don't have any pain. So the technique, the way, if I applied the perpendicular, but I can't do it. Perpendicular needle, I'll get very pathetic pain because that is inside the muscles. The muscles get contraction, the needle gets spindles. So that particular time really causing the pain. Now horizontal direction, so now I can place it like this, then I can let it be there for 1 hour, 2 hours, 3 hours, but without having any pain. So this called as a horizontal direction or the cutaneous direction or the 0 direction. Right? 0 direction is exactly as you mentioned as the REN Meridian. On the REN Meridian, how do you do that? On the Tiantu point, I used to apply. Today I think, by the way, I haven't applied on the Tiantu point. That is REN 22 point, slightly upward direction. Slightly upward direction. I just applied this. So this is a slightly slanting direction. That means it's the oblique direction. I just apply here. So this is not perpendicular, but this is oblique direction. Now I wanted to use on the REN 17 horizontal direction, that's called as a 0 direction. When I wanted to use as a in thong point also as a 0 direction we can use it, or we can use it as a perpendicular as well. Now I wanted to pinch the skin and I wanted to apply, see the needle direction. So needle direction is going and then inserting as a perpendicular. Now this is as a perpendicular. Slightly slanting this is, right? I further apply deeper level, but it touches to the bone. Now this is, I hope so, perpendicular. Now if I wanted to use this direction, downwards direction, that's called as a zero direction, right? So wherever the muscles are there, so which muscle having the more predominant, there appropriately you can use it. So this is also, you will learn each and every acupuncture point. I'll tell you what incision, what the depth of the needle to be go, half chun or the 1 mm, 2 mm, 3 mm, 4 mm, 5 mm, 10 mm, half chun, 1 chun, 1.5 chun, 2 chun, 2.5 chun, 3 chun, what depth the needle should go, I'll tell you. Each and every acupuncture point, you will going to learn that. By the way, there is in the book also is there, what depth the needle can go. This initial stages perhaps may required, later may not required. According to the anatomical location, you will know that, so here this much only needle can go. Right. Now the perpendicular needling 90 degree to the skin. He goes Susanli is exactly is the perpendicular. Oblique is the 45 degree to the skin. Liang Men, that is stomach for 21. Chung Fu, that is LU1. Where the horizontal 15 degree to the skin. The Pai Hui and then Shen Zong REN 17. You can apply 0 degree to 15 degree. That to be called as a horizontal direction. The Pai Hui DU20 you wanted to apply. You apply in the slanting direction, slightly slanting direction, where there is a DU21 and DU20. Together you just communicate. Together you just communicate. Yes, this is a very sensitive area. Oh, I'm fasting also, right? This is. The head area is the very sensitive area which causes the bleeding. The more blood supply to the brain, the more blood supply to the scalp. That's the reason very sensitive to get the bleeding, right?
So there is a technique where they try to use the intracranial pressure from there. They just keep something empty there and the blood comes out. Is it in acupuncture or something else?
Yeah, you mean to...
Acupuncture therapy.
Yes, of course. That's called as a, there is a, how the flickering method is there. Like that scrapping method also is there.
You just keep something and just hit it, then too much of blood comes out to reduce the intracranial pressure and it reduces the migraine.
Of course. Using the lancet we call as a 3-edged needle. So this is, we don't have the 3-edged needle. That needle is specifically will get in different places in China but not in India. But even the 3-edged needle, here I told you, in this particular area, once the where the more yang is nothing but is the fire. Yang Ming is the fire. Tai Yang is the greater Tai Yang. That means the great amount of the yang is there in this region, That time you just slightly 3-edged needle, you just puncture it, flicker it, the blood comes out, ooze out.
Oh, you are talking about the humid heat. You are talking about the humid heat.
Humid heat, that ooze out immediately. So that is recovery. UB40, you just do it. The patient feel lot of relief for the, once the ooze out the blood. Sometimes it happened to me many times when I do the procedure, that fallen on my hairs, that fallen on my clothes, right? So this happen. That's one way is whatever there is a inflammation is there, hotness is there, then you feel the meridian is the excessive fire. Pulse diagnosis you just see that is the one meridian having the excessive fire. Rapid pulse is there, one meridian. That meridian, any specific region, you just bleed it. Once few drops or 10 drops, even you can do the cupping in this region. Once you do that procedure and do the cups and the maximum amount of the blood comes out, you feel more relief where exactly the intracranial pressure or the cerebrospinal fluid having the excessive heat in the epidural region, especially in the subarachnoid space, that comes out. Then the patient feel more relaxation to get induce the natural sleep as well.